Hello, everyone. Thank you for attending our virtual shopper event this Thursday afternoon. My name is Pooja Tiwari, and I, along with co-organizer Maria Rodriguez, work in the Sales and Broker Relations Department at Valley Health Plan under our manager, Ashley Bejarano. Valley Health Plan wants to thank Latinas Contra Cancer for partnering us for this event. I will now hand it over to my co-organizer Maria to say a few words.
Thank you, Pooja. Hi, everyone. My name is Maria, and I'm very excited to host these events along with all of our departments and partners. Pooja and I wanted to provide our community with informational events that we would all find helpful during the pandemic. We can't thank you enough for participating and for taking time out of your busy days to join us. Now to get started, Pooja will speak about the agenda.
So this is our agenda for the event. We asked for our presenters that when you see the individual slide for your department and organization, you unmute yourself in order to prepare to present. Until then, everyone else who is not presenting will remain muted. If you have questions throughout the presentations, please write them down. There will be time at the conclusion of all the presentations to have a Q&A session. But now we will kick off the presentations by starting with Betty from the Sales and Broker Relations Department here at Vhp.
Thank you so much, Pooja and Maria, for putting on this event. It's been great working with you and organizing this event. And I just want to say thank you to everyone who are in attendance. And Pooja, just a sound check here. Can you hear me okay, or how's the volume?
Yeah, you sound pretty good.
Perfect. Thank you so much. Just again, want to thank everyone taking time out to be here with us, with the Vhp family and team. I want to go ahead and introduce myself. My name is Betty Ho. I am with the Sales and Broker Relations Department. And currently we work closely with the brokers in Santa Clara County, as well as in San Benito County, and members in our network. And so going forward, wanted to go ahead and ask Pooja if we can go to the next slide, and I'll go ahead and introduce the next topic here. So a little bit about Vhp. We are local. We started in 1985 as an HMO. We've been around for about 30 years now. Today, we provide coverage for over 162,000 county residents and employees along. Since Cover California went live in 2015, we also signed up. We were with them since then. We are the most affordable in the area. We make affordability a priority. We prioritize that as well. We know that our community values good coverage, and we try to keep our prices competitive. For 2021, Vhp is still the lowest cost option for the most popular middle tier plans in covered California. That's minimum coverage, bronze, and silver. We're really here to support you, so we want to provide quality services. When you do call our department, our sales team, a Vhp broker or a Vhp broker, you'll speak to a real person who lives or works right here in the county. Next slide, please. And we want to show you a bit of a reflection of our community. About 51% of Santa Clara County residents speak another language other than English. We do have a total of 144 languages that are supported with no-cost translation services for our community and members. The top two languages that are spoken at Vhp for support is Spanish and Vietnamese, Como te llamas and Chào quý vị, thương mến. Next slide, please. If you're already a Vhp member, then great. You are getting a great deal on your monthly premium. There currently are no preventative care. If you are currently a member, preventative care includes things such as annual physical, most screenings, and they are tied to the age of the family history. So don't forget about all the low costs or no cost benefits that are included in your plan. Our member services team and health education team will tell you more soon. However, if you're not a Vhp member yet, if you have a minimum coverage, bronze or silver plan, you can of course switch to Vhp during this open enrollment period to save on your monthly premium. Premium assistance is available through Coverage California for households who make up to 600% of the federal poverty level. That means a family of 4 with a household income of up to $154,500 can still qualify for insurance for assistance. Next slide, please. And here are some of our IFP products included with Coverage California. Through Coverage California, you can shop and compare, and you can see if you are eligible for a subsidy, as well as we'll screen you for Medi-Cal as well. Through Coverage California, you have the option to pay now. If you go with Vhp Direct, it's not subsidized. However, all immigration statuses can apply. It's a real quick and easy application, and you can pick your PCP at the time of application. Next slide, please. If you're not familiar, we do have MD Live. MD Live is 24/7 online option for same-day video or telephone appointments for most primary care services. In terms of payment options, you register for auto pay or quick pay by visiting our Vhp website. We do have a member portal. You can register for the member portal and make PCP change requests or new ID cards or view claim status. Next slide, please. There's several ways to enroll. We have our Vhp Direct. If you are working with a Vhp broker, you can use DocuSign, or you can also fax or secure email, send us through a secure email. And just to go over what the completed application must include: signatures for all enrollees that are 18 years and above. The primary subscriber, we will need a copy of their photo ID, and of course we need proof of residency, such as a phone bill, etc. A special enrollment documentation if it's applicable, and all immigration statuses again can apply. Next slide, please. For the Vhp New Member Experience, we have several steps that you go through. First, you would apply through Coverage California or directly with Vhp through your enrollment. Coverage California enrollment data can take up to 3 to 5 business days to show up in our system. If you use the Pay Now button to enroll through Coverage California, Vhp Direct applicants will receive an invoice after the application has been completely processed. In terms of connecting to a PCP or selecting a PCP, you can contact member services to do so, and you can include the preferred PCP in the Vhp Direct application as another option. Your ID cards will be mailed to you after payment has been made and PCP is assigned. The member ID card will be sent directly via standard email. Sometimes it will take 10 to 16 business days for that to take place. In terms of our billing, premiums are billed on the first Friday of every month, and payment is due on the 27th of each month. We do have access to a member portal for all of our members. They can register for the portal to view or change their PCP, change their claim status, or access temporary ID cards. Next slide, please. Why should you choose Vhp? Again, we want to express quality services. Vhp is an accredited health plan and is proud to offer assistance in your language, in person, or by phone. We are the only locally based health plan serving the community for over 30 years, and as well as the most affordable in the area, the lowest cost plan for most popular middle tiers, complete with free preventative care and health services. Next slide, please. And now I'd like to introduce to you Martha Cisneros from our member services team. Thank you so much for your time. Martha, I'll hand it over to you.
I appreciate that, Betty. So hello, everyone. My name is Martha Cisneros, the Member Services Department Manager here at Valley Health Plan. And our team works closely with all the other departments highlighted here today, including the broker and sales team. Today, I'd like to take an opportunity to share some of the benefits and options available as an enrolled member to Vhp. Next slide. Valley Health Plan offers several primary care network options, one being Silicon Valley Medical Development. They were formerly known as Verity or San Jose Medical Group. We also have independent and direct providers, community clinics, Santa Clara Valley Medical Center, and very new addition is Physicians Medical Group of San Jose. They will be active and ready for selection on 10/1/20. Okay, next slide. As a shopper, you have an opportunity to view the list of providers offered to VHP members, and you can visit our website at www.valleyhealthplan.org. And the first step would be to find the provider icon that is actually circled in that highlighted area towards the bottom of the page there. Okay, next step. Here you will find the start of the provider search. It's going to ask you to select your product type. An example, are you a Covered California member? Are you going to be an IFP, individual and family plan member? And then for selection, you can choose for the service type provider, which is more of a general search of our provider list. And then you would just hit search. Next page. And on this page here, you will have the opportunity to filter your search. You can do that by provider name if you know who that is. You can do a search by specialty, open and closed panels, a language, a preferred language, location, and distance from a set, let's say zip code, or any combination of any of the filters identified here. Next page. Changing your PCP. Once you become a member, you have the opportunity to change your PCP at any time. And you can do that by simply calling the member services team or by requesting that in writing. You can contact us at this toll-free number here. You can come in and visit us, not currently because we're not in the office, or you can email us. Again, there is no restriction. You can change your PCP at any time, as many times as you'd like, and for whatever reason. The only thing that we need to make you aware of is that the effective date of your PCP change will be the first of the following month after your request. Okay, and your new ID card will be mailed to you within 2 weeks of your requested change. Okay, next page. Scheduling an appointment with your primary care physician. We ask that you use the online portal so that you can find telephone and address information for your providers. It's extremely important that you establish care with your primary care physicians as soon as possible, as soon as you become eligible and active with your plan. It's important to build a relationship with your doctor before a medical problem occurs. You want to provide that medical history so that your provider is aware of who you are and what your medical needs are. Something else I want to highlight is that preventive care and screenings are completely free, no cost to you, no copays, no deductibles. That includes general well health exams, well woman exams, diabetes and cholesterol screenings, routine immunizations and vaccines. Again, anything related to disease prevention is considered preventive care and completely free. Okay, next slide. Specialty care services and referrals. So we are an HMO, and specialty services will require an approval from VHP. Your primary care physician will be your first point of contact. You will go see him or her, let your primary care physician know of your medical condition. They will triage you, evaluate you, and then submit the request to Valley Health Plan for approval. Valley Health Plan will then review the request and identify if it can be approved or denied based on medical necessity. It's important that you have your authorization before you schedule an appointment with your specialist. If you arrive to a specialist and are seen without the prior authorization, you could potentially be financially responsible for that visit. Okay, next slide. Coverage with VHP does not include out-of-network options, which that means is that you are assigned a network based on your primary care physician. So you are not allowed to leave your network or see any provider that is not contracted with Valley Health Plan without an authorization. You could potentially be financially responsible for the full cost of services. Covered services are only through plan providers that are contracted within our network. However, we do offer you worldwide emergency services. Let's say you're out of the country and you have an emergency situation that requires you to go to the emergency room. We will cover those services. You will, however, have to pay that up front. And when you return, you submit your claim for reimbursement, and we will review that minus any copays or deductibles that apply and reimburse you for those services. Okay. In case of a medical, oops, go back one more time. I'm sorry. And in case of a medical emergency, regardless of where you are in the country, please go to the nearest emergency room. No restrictions apply. And that's, again, within the United States. Okay. As mentioned, we do have a portal for our Cover California and direct numbers. And on our landing page, which is www.valleyhealthplan.org, you find a small icon towards the top of the page, which is on that highlighted box there. Okay, next page. It'll take you to this next landing page, which will allow you to click that purple button there that says Portal Access. And the benefits of this access into this portal is that you're going to be able to view your eligibility, your benefits, search claims and authorization history. You can order new ID cards. You can request a PCP change. It allows you to look at pharmacy links. It has various bits of information that you can actually access on your own without having to navigate the system or having to call member services. So this is actually very useful for our members. Next slide. This is where you go into that portal registration piece. So if you've never created a profile, you would want to do that by clicking on the member registration. And there's a couple areas where you can do that, again, highlighted in those boxes below. Clicking on the member registration or not registered and clicking on member. Next page. MD Live. So Betty actually had an opportunity to highlight this earlier as well, and I want to actually highlight this even more. So MD Live is telehealth services. You can access basically urgent care services anywhere at any time, 24/7, 365 days out of the year. Your copay is equal to the copay equivalent to your primary care physician. So if you pay $10 at a primary care physician, that is what your expected copay would be with MD Live. You can access services through a computer, smartphone, tablet, or simply your telephone. We offer over 200 languages. No authorization is required for these types of services. MD Live has providers that will provide you with a prescription of medication if that is required. And you have the opportunity to activate your account by doing that online, calling them directly, or downloading the mobile app. Although you can't establish a primary care physician, you do have an opportunity to establish with a behavioral health therapist, psychiatrist, psychologist, for those that want to maybe reserve some privacy, don't want to go to the office, or just don't have the time to go to the office based on the provider's schedule. So that's actually one of the great benefits that we offer as well. Next slide. Pharmacy benefits. We have several pharmacy networks, and we have an extensive formulary. Several offer mail order. We also offer you specialty pharmacy, an example, compounding medication, an extensive list of prescription benefits. Some of the pharmacies that we offer would be Nationwide Walgreens, Nationwide Costco, and you don't have to be a member to actually access the Costco pharmacy. You can just walk in, let them know you need to access the pharmacy, and they'll let you right in. Safeway Albertsons, Rayleigh's, Santa Clara Valley Medical Center. Our specialty pharmacies would be Lumicera, Santa Clara Valley Medical Center, and Costco we highlight because they have a really robust mail order pharmacy program as well. Okay, next slide. Laboratory, we offer quite a few locations. Santa Clara Valley Medical Center, laboratories, and also Quest Diagnostics. They actually offer locations throughout the county. And they're easy to access. You can actually go online, book an appointment if you want to do that, or look at the different service locations that they have maybe closest to your home or location. Next slide. For those that are under pediatric coverage, the coverage allows you to have vision and dental care. Again, this is for children under the age of 19. VSP is a vision care provider, and they offer vision examinations, contact lenses, frames with limitations, and coverage limitations. And if you needed to contact them, this is their contact information here. This is for VSP. Liberty Dental, the same. The coverage plan offers dental services for children under the age of 19. And again, robust dental benefits, very useful for children that need to get in to do their annual or semi-annual cleanings, and very easy to use. Again, you can go online and see their list of providers available to you. Okay. So Member Services is here to assist you. Again, as highlighted earlier, changing your doctor. We can offer you assistance with getting a member ID card, how to see a specialist. Maybe you just don't understand how the authorization process works, or you want us to identify a specialist in your area. We can do that for you as well. And bolded here, understanding your plan benefits. We are here to help you understand your plan benefits, your coverage, your co-pays, your deductibles, your maximum out-of-pockets. You can count on us to help you understand all those areas of your plan. Again, authorization and claim status, insurance premium assistance, and so much more. Okay, next slide. So that's the end for Member Services. Thank you, everyone.
Thank you, Martha. Up next, we have Mylene and Fernando from the Health Education Department.
Hi, this is Mylene, and thank you so much for allowing us to present the Health Education Department's program to you. Can I have a next slide, please? So, Health Education Department is a health promotion program that aims to engage and empower members to choose health behaviors and make changes that reduce the risk of developing chronic diseases and other morbidities. We are the most exciting department within Valley Health Plan. We are a call away, and anytime when you need us, give us a call. We're always there to assist you with any opportunity in terms of health education classes and fitness classes. Next slide, please. At this time, there are 4 different components that we are offering through Health Education Department. You may want to go into the website and take a look at what we have to offer. However, there are 4 options that you can look at. The first one is chronic disease prevention, and then the weight management program that we offer, Weight Watchers, Reimagine, as well as fitness classes. And we're very excited to report that in the next few weeks, we will have a virtual classes, fitness classes for you to take advantage of if you're interested. And we hope that you become a member and taking advantage of all the classes that we have to offer, and it's all free. We also have a breast cancer screening campaign that happened, and we strongly encourage, especially women ages 50 and over, to get your mammogram screening done every year. And for that, we also offer a wonderful incentive gift that we send directly to your home. And if you happen to go to community events, chances are we are there. So please come and visit us at Health Education table for Valley Health Plan. We would love to talk with you, as well as to give you many really small gifts to bring home. Next slide, please. And at this time, I wanted to talk to you a little bit about the diabetes prevention program. As you know, 1 out of 3 U.S. adults has pre-diabetes, and only 10% know they have it. And at this current time, we're partnering with YMCA to provide a free adult diabetes prevention program to our at-risk member. The DPP helps members focus on lifestyle changes to improve their overall health and well-being while lowering their risk of developing diabetes. Once you register for the diabetes prevention program, you will also receive a free membership to work out at YMCA. Unfortunately, because of COVID-19, YMCA Fitness Center is not open right now, but once that we have the green light from the county and from the state, you are free to work out at YMCA if you are eligible and participate to the diabetes prevention program. Thank you. And next slide, please. One of the excited and a very popular program that we have to offer to our member is at Timpani Center, we have the Aquatic Program. And the Aquatic Program will offer you classes that you can choose. You can either go for just an open swim, or you can also register to attend a classes that is particular to your health. And we have all the information on our website if you're interested. Once that you become a member, you are qualified to participate in the Aquatic Program. Next slide, please. Another program that we have to offer for our member with a very minimal fee is the Weight Watchers program. With the Weight Watchers program, we wanted to make sure that if you interested in this program, for your health, to lose weight or eat healthier, or you can move more and develop a more positive mindset, or all of the above, we encourage you to participate with the Weight Watchers program. What's included is you access to a lot of exciting features, including exclusive mindset content through Headspace, and incredible products and experiences through our rewards program, Wellness Win. So there are 2 different programs that you can register or enroll to. The first one is the Digital Plus Workshops, and the other one is the digital. For Vhp member, you only pay half of the price for the Weight Watchers program that you enroll into. Next slide, please. And also, as I mentioned earlier, we have a very robust fitness program that you can take advantage of. We offer many different classes, from yoga to total body fitness to Zumba to all those jazzercise and all those wonderful and exciting dance classes. Like I say, at this time, all the classes are on hold because of COVID-19. However, we do offer a virtual classes that you can take advantage of. And hopefully, we will have all that upload on our website in a week or 2. Next slide, please. And that's about my presentation. And I'm hoping that you will make the decision and become one of the member. And we are here as a family. And we love to be part of your family and provide you with the best healthcare program, as well as health education. Thank you.
Thank you, Mylon. So up next, I believe we have Betty.
Up next, I believe it's Darcy from Latinas Contra Cancer.
Hey, thank you for having us today. We're really excited to be here to share a little bit about what we're doing for patients at VMC. You can go ahead and go to the next slide. Perfect. And I just wanted to say that the presentation has been great so far. We're particularly excited about the health education work that you're doing, and we'd love to partner with you on the breast cancer awareness in the Latino community if you are open to that. We're doing a lot of that type of education now ourselves. If you can move to the next slide, please. Latinas Contra Cancer exists to create an inclusive healthcare system that provides services to the underserved Latino population around issues of breast and other cancers. That's our founding mission. Over the years, our mission has continued to stay this, but really has evolved into creating a more equitable and just access to the healthcare system and health for the Latino community around issues of cancer. Next slide. We've had a partnership with Valley Medical Center for a little over 10 years. We've provided patient navigation and survivor support through our Spanish language support groups. We continue to provide patient advocacy. We're no longer doing patient navigation inside the cancer clinic, but we are still providing patient navigation and patient advocacy and survivor support to VMC patients. We're also providing health education to the community at large. Actually, all of our programs are for the community at large, but the population that makes up the majority of our client base are VMC patients, just given that we work with the low-income Latino community. Our basic program areas, as I mentioned, health education. We have a tailored, culturally and linguistically competent program that we've been using for over a decade to educate the Latino community around all different types of cancers, clinical trials, environmental risks, ways to lower your risk, and just basically debunking myths that exist around cancer screening and cancer prevention. Our patient navigation is like traditional navigation. If someone needs help with scheduling a mammogram or a PAP or a colonoscopy, or someone needs help navigating clinic systems or hospital systems, we have folks who can help them. Our survivor support is we have an English support group that is still Latino based and culturally competent, but it's in English. And then we have our Spanish language support groups that meet twice a month that are in Spanish. The curriculum that we use for our support group and the program we use has been researched and tried. We were part of a cohort with Georgetown University developing the program that we use that we know works in the Spanish-speaking Latino community. And research and advocacy, have been doing a lot more patient advocacy. I would say this year we actually launched a patient advocacy program, and what that looks like is really case management. So with the onset of COVID, we saw the number of hours we were spending with each client go from 15 minutes to 15 hours, depending on if they needed help with abnormal screenings or those kinds of things, to now we have clients who we've worked with for months, since March, right? Since the pandemic, we're working with on a weekly basis as they struggle to navigate the economic hardships caused by the pandemic, along with a cancer diagnosis or other chronic conditions, or basically just trying to access prevention. And then the research part, we participate in a lot of community-based research projects with various universities and hospitals. And we also do our own advocacy on behalf of the Latino community who is trying to access the healthcare system. Next slide. This is just a little bit about how our work is pivoted. So since March, we've adjusted to meet the needs of our clients who've been impacted by COVID. And impacted by the shelter-in-place ordinance. The clients we serve are primarily Latino, not exclusively, but for the most part, low income. Most are Spanish-speaking, and many of our clients are undocumented. Our clients are navigating the sudden income loss and are unable to pay essential bills, and some owe thousands in rent. So our organization exists to help people navigate those social services as well. We work hand in hand with VMC medical social workers, like a team, to try to fill in the gaps for people and We know that the staff at VMC work very hard, and there's a big client list, so we try to fill in and bridge some of that gap. Then we can spend a little more time with each client, getting to know them and their families, and for the long term, try to help them find the services they need. Just this last bullet is just about housing right now. Many of the VMC patients that we see are struggling to pay rent, so that's one of the big issues that we're dealing with. Next slide. It's just a snapshot just to show how much we appreciate our partnership with VMC. 78% of the clients we serve stated VMC to be their medical provider. Of those who did not list VMC as a medical provider, we know they are seen in other community clinic systems, which sometimes feed into VMC. 49% of our clients are on emergency Medi-Cal, and 28% are on full scope Medi-Cal. 13 remain uninsured, although they all are, those clients are receiving their care at VMC. And we do have a subset of our clients. I didn't put the data here, I should have, but who are on the Valley Health Plan. Next slide. This is just a little bit of our health education. We've transitioned our health education into an online forum. Normally we meet in person, and it's very, it's like a big family. You know, we're trying to break down these barriers to talking about what can be very difficult issues having to do with your body and health. And we have recreated that trust and relationship building in an online space. So this is an example. You can see all of the babies and moms who are there. It's a very welcoming space where we're talking. This particular one is about breast, but we do all of the major cancers that are impacting our community. We're going to be holding, I think, 4 of them this coming October about breast, given that it's Breast Cancer Awareness Month. But then we'll probably begin to rotate out which subjects we talk about. So again, we would be happy to partner on some of these that we're doing in the community. Next slide. This is just an example of what our health education normally looks like. So health fairs, different speaking opportunities. We go on Spanish media. These, if you can see here on the top left-hand corner, that's a typical bingo that we have, kind of like a loteria game that we teach about different cancers. It's Daisy, our former health educator, student health educator, who's teaching a group of women about cancer and cancer prevention. In the bottom left corner here, there is, and actually also this little boy up here is actually my son. They are participating in a health education event that's around environmental risk factors and toxics and chemicals that exist in our products. So little boy there, he is making a face paint for Halloween. We taught families, Latino families, how to make their own organic chemical-free face paint and taught them about the chemicals that exist in that highly unregulated industry. And then the women who are down there in the bottom left-hand corner are making their own chemical-free foot scrubs and body scrubs. It was an event called Toe to Toe with Cancer, where we taught women about what's in their home beauty products and personal products and how to make some of these things very inexpensively and with things you probably already have around the house. And then in the middle there is one of our displays around our Wig and Prosthesis Boutique, our mastectomy boutique, and then the right-hand corner is just an example of some of the interactive health education tables we have. Next slide. Patient navigation and patient advocacy. So we've been navigating people through the social safety net, as I mentioned. We provide navigation through the county hospital and community clinic systems. We give health-based case management, patient advocacy, translation, transportation, help with medical bills. This is Jackie, our patient navigator. We were doing a food distribution that day. This flyer here around says COVID financial assistance. This was a partnership we had with Destination Home, a partnership we continue to have, but we dispersed $119,000 into the community around from about July to August. Many of those folks who received this financial assistance in either $1,000 or $2,000 gift cards were VMC patients. Next slide. And many of those patients we were able to identify with the help of VMC medical social workers who were able to send us people that they knew would be eligible for these funds that met the basic requirements. And so we were able to help them. Our cancer support group, so here's a snapshot of the days and times. They cover, these are the basic things that they cover: stress management, anger management, intimacy after cancer, spirituality in cancer, improving communication. You can see the list here. They are run by a licensed therapist who has years and years and years of experience doing this work, and is herself linguistically and culturally competent to do this work. Our cancer support groups, you have to register for them. So if you have anyone who is interested, they're welcome to call our office, and we have an intake process and an initial screening. Along with admission to the support group comes a total of 3 hours of individual counseling from our therapist as well, if needed. Next slide. This is our Wig and Prosthesis Boutique. We're very proud of this. We opened it last March of 2019. We've always dispersed free, no-cost mastectomy garments, breast prostheses, and wigs. But in March of last year, we cut the ribbon on this beautiful space because we really wanted to create a space that had the dignity and love that all of our clients deserve, and a space that they could be waited on and served by our staff, and also a place where, even though these are no-cost items, people could shop for their own items and really pick out the things that they want and that they need in order to feel their best when they walk out. So women can take as long as they need in this space and try on different things. We are still offering these items in this time of COVID. We have a very different protocol in order to keep everybody safe. So there are our physical office is actually closed. We're all working remotely, although all of our programs are still running. And we are doing these fittings by appointment. So we have English and Spanish speaking mastectomy fitters, trained mastectomy fitters. And we just got a huge donation of about 1,500 wigs from the American Cancer Society just the other day. So we have a lot of inventory. We rely on donations to keep this boutique running because everything is free. We do not require any type of insurance. Most of the women who come to us for this boutique are also VMC clients. We know that for Medi-Cal clients, it's difficult to access these services because there are not a lot of boutiques that accept Medi-Cal who accept insurance reimbursement. So we intentionally do not get reimbursed for this so that we can just make it easy, no waiting, just very stressless way to get the items that you need. So anyone can make an appointment for this space. Next slide. Again, this is just more of our boutique. This is the fitting room and a few of our displays. As you can see, it's meant to look like a boutique. We currently aren't actually using the fitting room or the boutique itself. So what happens if someone needs an appointment or needs one of these items, a wig or a breast prosthetic or a bra, or sometimes all three? We have a different space in our office that is much bigger, it's much more open air, where we are fitting everybody. And obviously we have all these different protocols in line with the county protocols around staying safe. Next slide. A little bit of the research we're talking about. I'll just kind of quickly bit on this. It doesn't have too much to do with VMC other than the fact that it's cancer-based, but we put on every other year a National Latino Cancer Summit. We would have been this year, we didn't put it on, but we're moving it to next year, and it'll be our 7th biannual National Latino Cancer Summit, where we bring together researchers, academics, doctors, practitioners, community advocates, and survivors from around the country to talk about the issue of cancer, health access, the patient experience, all of the things that make up the Latino experience of cancer through the continuum and the Latino experience of the research behind and science behind cancer. Next slide. So that's it. That's what we do. Again, we value our partnership with Valley Medical Center. We look forward to continuing to partner to serve our mutual clients and patients, particularly in this time when everyone is trying to navigate the devastating impacts of COVID-19 and the shelter in place that we know have disproportionately impacted the Latino community and in turn have disproportionately impacted VMC patients. So we appreciate to be a piece of that puzzle that's going to help us move forward from this. And if we can be helpful, or if you would like to know more, you're welcome to email me or call us. Thank you.
Thank you so much, Darcy. We truly appreciate your partnership with VHP. Up next, I believe it is our Q&A. So for this part of the event, we are going to unmute everyone to give you guys the chance to ask questions, or you can also type them on the chat and we will be on the lookout for questions on there. We are asking if you can specify the department that you want to ask your question, if you know who the question is directed to. If you don't know the department that it is being directed to, it's completely fine. So yeah, so we'll give about 5 to 10 minutes for any questions. Feel free to either unmute yourself or type it in the chat.
If you're called in and need to unmute yourself, you can hit *6 if you need to. So we have a question in the chat. How can I check my brokerage status with Vhp? I will hand that over to Betty. Is it there still? Yes, Betty.
Sure. Hi, this is Betty. Yes, to check your brokerage status, you can call us directly at 885-3560, area code 408, or you can also email us at brokerrelations@vhp.sccgov.org. I'll go ahead and add that into the chat.
Thank you, Betty. Does anyone else have any other questions? Okay, so I'm going to go ahead and pass it on to Pooja for some concluding remarks.
Thank you, Maria. So thank you again for everyone who attended this event, from our presenters to our attendees. This slide shows our flyer for Vhp's series of events. So in case you did not know, this event is the third of 4 events that Vhp is putting on throughout the month of September, and our last one is in October. Every single one of you is invited to our final event, which is 2 weeks from today. It is a COVID-19/flu table talk in which strategies to prioritize your health during this fall season will be discussed. Now, that is all we have. I hope you all have a good rest of your day, and I'm looking forward to seeing you at our final virtual event of this series. Thank you.
Thank you, everyone. I truly appreciate your participation. Big thank you to our departments and to Darcy. It was great talking to everyone today. Have a great weekend.
Thank you, Pooja and Maria. Great work.